Alan, could we start out with just asking you to tell us, what is harm reduction? What do you mean by that?
Well, you know, it's sort of in some ways self-explanatory in that harm reduction is programs which could be working with individuals, it could be policies, it could be environmental changes designed to reduce the harmful consequences of using substances, drugs, but also alcohol, cigarettes, could be legal or illegal drugs. So the goal shifts it a little bit from, is this person an alcoholic or an addict, or sort of looking at the diagnosis of the user, but looking at the consequences. What's happening as a result of this using of substances? What kinds of harmful consequences are there? And what can we do to reduce it? And of course, abstinence would be an ideal goal because it tends to be the lowest risk, and it's sort of on one end of the continuum. But for many people, abstinence is not something that they can attain right away, or they're unwilling to consider it. And yet they're putting themselves and other people's behavior at risk. For example, sharing needles for intravenous drug users can obviously increase the risk of transmission of HIV. And so actually harm reduction started in countries like in the Netherlands around issues about the link between drug use and HIV, and what could we do to reduce the harmful consequences for people who, even though they're still actively injecting drugs. So that would be probably the first big example of harm reduction that we're all familiar with.
In a minute, we're going to watch you work with a young man. Can you help our viewers know what to look for? What is it that you're hoping to accomplish? Yes.
This young man is an active drug user, so he's an appropriate candidate for harm reduction. He's also, as you'll see, somewhat interested in the possibility of getting help and signing up for a program that his brother is in. His brother also has a heroin problem. And it's interesting because it's a methadone program. So even though we would think of methadone as harm reduction, he's not even quite there yet. Because he's really trying to deal with the whole issue of survival and whether he can do without drugs in his life, and he's got some good reasons to.
He's contemplating.
He's contemplating. So I try and meet him where he's at around that and try and get some understanding of how the drug use is affecting him. Of course, I'm probing for harmful consequences. So I'm asking questions, how is he administering the heroin? Is he IV shooting up? Turns out no, he's actually snorting it. Snorting is a little better than shooting up because of a less risk of overdose, but I'm still probing overdose possibilities. Because, you know, heroin overdose deaths are getting higher, not just in certain levels of society, but even in adolescent, upper middle level America. We just had all these heroin overdose deaths in Plano, Texas. 18 teenagers died, and they were snorting, so it's not. So then, but also
making an assessment then.
Making an assessment of the harmful consequences and trying to figure out what he's capable of doing as a first step. So I'm trying to break it down to proximal goals rather than, but I'm also asking him, where does he want to go eventually? Because I think that's part of the motivational process is, here's where you are now. It's like a journey. You're here. You want to go there. In his case, it's, you know, because of his family and so forth. So how are we going to get there, even though he's thinking, I can't get all the way to the end right away? Where can he start?
So you get this long-term goal, and then you try to break it down with some increments.
Yeah.
Watch. Well, let's watch.
Okay. Sounds good.